Hi, my name is Asaad Chaudhry, and I'm going to be presenting our poster on the reporting of harms in systematic reviews focused on reverse shoulder arthroplasty, a cross-sectional study. So, reverse shoulder arthroplasty, or RSA, is projected to increase in frequency in the next decade by over 300% due to the recent expansion of indications for this procedure. Therefore, it's critical that we have a more thorough understanding of the efficacy and harms for this procedure. Systematic reviews are commonly used to guide clinical decision-making in orthopedics, but they're also known to weigh efficacy more heavily than harms in their reporting. Therefore, the objective of this investigation was to perform a cross-sectional analysis on the completeness of harms reporting in systematic reviews related to reverse shoulder arthroplasty. We did this by starting a comprehensive search using Embase, Medline, Epistemonicos, and the Cochrane database of systematic reviews to scan for relevant literature. Our search returns were screened for inclusion and extracted data using a masked duplicate method. And the general study characteristics, the harms items, and overall methodological quality for each systematic review were extracted. A corrected covered area was quantified for systematic review pairs, and AmStar was used as a quality appraisal tool for each systematic review. Stata 16.1 was used to conduct a bivariate analysis between variables. What we saw was, after screening and full text review, we had a total of 89 systematic reviews, and of these, 26, or almost 30%, reported 50% or less of harms items. 15 or 16.9% included a pre-specified protocol that addressed harms. 38 or 42.7% listed and separately defined harms in the method section, and 84 or almost 95% of systematic reviews were graded as critically low quality by AmStar 2. In Figure 1, we see our flow diagram of study selection, which basically outlines how we narrowed down to 89 systematic reviews. In Figure 2, we see the harm scale for included studies, which basically depicts the percentage of systematic reviews out of our sample that reported less than 50%, 50%, or over 50% harms items. And in Table 1, we see a summary of characteristics of included studies, including indications for RSA, adherence to PRISMA for each systematic review, favorable interventions, whether or not the harms were listed as primary or secondary outcome or neither, conflicts of interests, funding sources of each systematic review, and the AmStar 2 rating for each systematic review. So overall, we found that our sample and all our findings suggest inadequate harms reporting pertaining to RSA and systematic reviews. To illustrate this, nearly 30% of systematic reviews related to RSA in our sample failed to report at least 50% of harms items. So we recommend improvement to reporting guidelines regarding harms reporting, and that these improved guidelines be used by future studies. Complete harms reporting may facilitate better patient outcomes and allow for more thorough risk-benefit assessment.